So Myeloma XI is a really large study for newly diagnosed myeloma patients that was carried out all over the UK at over 100 centres. It has pathways for both transplant eligible and transplant non-eligible patients. Here at EHA, I'm presenting results from the transplant eligible pathway, in which we had over 2,000 patients enrolled. These patients were randomized to initial induction immunomodulatory triplets based around either thalidomide or lenalidomide combined with cyclophosphamide and dexamethasone. The results I'm presenting at the meeting show that we have deeper responses with the lenalidomide-based triplet compared to the thalidomide triplet, and that this translates into a progression-free survival and overall survival benefit for those patients. We have previously presented results around the maintenance randomization of the study, which compares lenalidomide maintenance given until disease progression to observation. We have further analysis looking at the genetic risk of these patients based on translocation and copy number abnormalities. And we have previously demonstrated a very impressive benefit in terms of progression-free survival for those patients who got lenalidomide compared to observation. And the data that I'm presenting here shows that data for the transplant-eligible patients and further examines outcomes based on cytogenetic risk. And we can see that that benefit for lenalidomide is present across all risk categories. So whether the patient is standard risk, high risk, or even ultra high risk patients still benefit from lenalidomide maintenance over observation. And so putting these two aspects of the data together, we now have an opportunity to look at the interaction between having lenalidomide as induction therapy and lenalidomide as maintenance therapy. And we find that those patients who had lenalidomide both upfront and as ongoing maintenance therapy did the best. We hope that this data will support the use of lenalidomide maintenance as ongoing therapy in newly diagnosed myeloma patients after autologous stem cell transplant.